Walk past a newsstand just about anywhere, and you will see beautiful and very thin women on the covers of magazines. These images influence the way women and teenagers look at themselves.
I look at the magazines and I'm like, wow, that's amazing. I wish my stomach could look like that.
I want my stomach to look better than it does right now. That's the only thing that I really care about.
Research shows 80% of American women and girls are dissatisfied with their bodies. Although most do not develop eating disorders, some do. Anorexia is a psychiatric illness that can have deadly consequences. Patients think they are overweight, even if they're not. They starve themselves and overexercise. Anorexia can lead to malnutrition, osteoporosis, and heart problems. It can also lead to premature death or suicide. Toni Saber realized she needed help when she awoke from a coma related to anorexia.
Once you get to a certain point, you can't stop. You get kind of like a very euphoric feeling just looking on that scale and watching it go down every morning.
Low self-esteem and difficulty with relationships are risk factors, but some experts say cultural pressures that glorify thinness are the strongest risk factor. Psychiatrist Dr. George Groves.
One of the first cases I saw in training was a lady who was 23 years old. She was 5'11" and weighed 67 pounds. And what was striking about that was when you looked at her and looked, it's like a concentration camp survivor, she would literally be able to look at her body in a mirror and point to you where she needed to lose some weight.
Anorexia is difficult to treat. This is video of Israeli model Hella Elmaleh before her death last year. Only about 25% of patients recover completely unless treatment starts early. Dr. Denise Wilfley at Washington University in St. Louis is leading a study on the disorder.
Our goal is to identify the most effective treatment for adolescents who are suffering with anorexia nervosa. It's the largest scale study to date.
The participants will be divided into groups that receive different forms of family therapy.
It seems like that there's a better effect if you have a united family front and involvement. However, there are different strategies, and so one of the family therapists focuses much more on the eating behavior and changing the eating environment of the family, and the other focuses much more on changing the way the family members communicate and interact with one another.
Some participants will receive medication for anxiety and depression associated with the illness. Dr. Wilfley hopes the study will lead to better treatment for anorexia and a greater chance of recovery. Carol Pearson, VOA News.